Updated guidance from the CDC shortens the isolation time for healthcare workers who test positive for COVID-19. The change came just as Omicron took hold across the country. Newswatch 16's Carmela Maddaloni spoke to an area hospital about the changes.
It didn't take long for the Omicron variant to become the dominant strain of COVID-19. In just a few weeks, a surge in cases and hospitalizations nationwide. Just before the new year, the CDC updated guidance for healthcare workers who are exposed or test positive for the virus. Those who are asymptomatic can go back to work after 7 days with a negative test. Isolation time can be cut further if there are staffing shortages. Dr. Jeffrey Jerry is an infectious disease specialist at St. Luke's University Health Network. He respects what the CDC is doing, but says this is not a one-size-fits-all situation.
We understand what our situation is on the ground, and we also understand what we actually need, and we do feel that we can communicate much better with our employees without using some script that comes from the CDC, which has to cover a lot of different territory.
The updated guidance goes on to say healthcare workers who have received all recommended COVID-19 vaccine doses, including a booster, do not need to quarantine at home following a high-risk exposure.
So we're not going to bring back people who are going to be posing a risk to our patients. At the same token, we also have to be very practically minded in how we go about doing this. And we know that the recommendations by the CDC are not that at all, and they're very confusing.
Dr. Jerry says the network follows its own guidance. If and when healthcare workers are exposed or test positive, workers get sent home for a few days.
Anyone who's going to return, that they truly are asymptomatic and that they can get a rapid antigen test that would help endorse the fact that they're not going to be very transmissible. And to do that before day 5 is not valid. The other important thing is that when these people come back, it doesn't mean that they're totally home free. That for at least the next 5 days, we have to make certain that they wear a proper mask at all times, that they don't get into congregate settings when they're eating.
If you would like to learn more about the CDC guidance for healthcare workers, visit WNEP.com. Carmela Maddaloni, Newswatch 16.